To recap, we've been talking about mood and anxiety disorders and the genetic component. I'd like to go a little bit more deeply. So Dr. McMahon, would you please tell us, a lot of people feel sad over something. How do we know being sad versus a depression? Or a lot of people feel upset about something. How can we tell being upset versus having an anxiety disorder?
And that's an important question, and it isn't always crystal clear. Some of the things that psychiatrists would look for is if the sense of sadness lasts day after day or persists despite a change in someone's circumstances. Another important indicator will be if the depression is accompanied, if the sadness is accompanied by other symptoms of depression. We recognize these to be changes in sleep or appetite, a loss of energy, a loss of interest in someone's usual activities. Another important sign of depression can be if someone begins to think about suicide or wishing they were dead. In very severe cases, the low mood can be accompanied by actual hallucinations or delusions, that is, hearing or seeing things that other people can't, or becoming convinced of ideas which really aren't true. In the case of an anxiety disorder, a similar story applies. We all feel anxious at times, and as I mentioned, that can be a healthy reaction in situations where it's important for us to be alert or on our toes. We talk about an anxiety disorder when the anxiety is either very persistent or becomes untethered from the usual situations that would be considered threatening. So when someone feels tense, jumpy, and jittery all the time and can't relax, or when they suddenly have severe anxiety symptoms out of the blue, or in reaction to things that most people would not consider threatening.